Hello, everyone, and welcome back to the Manifesting Health series. I'm thrilled to have with us today, we have Dennis Barbour, who is the president of the Partnership for Male Youth and an attorney who has spent a career leading nonprofit medical organizations. Welcome, Dennis.
Thank you.
Excellent. So as we get started, let's spend a little bit of time. You kind of tell us about your background and how did you end up in the space that you're in currently with the Partnership for Male Youth?
Well, in the past, I was the president of the Association of Reproductive Health Professionals, and that was largely gynecologists and nurse practitioners in reproductive health. And it was mostly women's health care. And I kept saying, well, what about the guys? And the answer was, what does that mean anyway? What's men's health? So for some time, I had had this idea that we needed to do something in that space. So in the late aughts, what I did is I pulled together a group of the physicians that I have been working with in reproductive health and have a discussion about whether there should be an organization and how we go about that. The consensus was, yeah, go for it. It's really a good idea. I did a needs assessment process where I actually interviewed about 150 medical specialists all around the country to see what the consensus was, whether this was a need and whether we should do this. And the consensus was, yes, absolutely, go for it. So we started in 2013. That's when we started.
Excellent. Thank you so much. And you're talking about the needs assessment and the clinicians and the people within spaces of practice and education. And you said that there's certainly a need. Can you tell us a little bit more about what the needs were? What are some of the things they shared with you that are the biggest gaps when it comes to our male youth?
Well, there are a number of things. The most important point is that by the time they reached late adolescence, most males and females stop seeing a primary care physician. But females typically transition to gynecologic care. The gynecologist is their gatekeeper for healthcare. The guys just drop out of the healthcare system altogether and don't receive primary care. That's where a lot of the problems emerge. With the exception of sports physicals and visits to the ER, they don't have any contact with the healthcare system.
Why do you think
That
that is? Why do you think they drop out?
Well, it's training and
Mm,
access. There are, in this country, what's really kind of appalling, really, is that there is a medical specialty called adolescent medicine.
mm.
There are only physicians. There are only 1,000 of them in this country. And there are
Well,
34 million adolescent males. So the ratio is 1 to 30,000. The problem is that primary care physicians are generally not taught about male health care. That's number one. Number two, the parents just simply, when they're adolescents, the parents don't send them to primary care providers after a certain age, and then they're on their own. And guys being guys, they think they're fine. There's nothing wrong with me. And so those are the two issues that really are in play here.
it's interesting you brought up sports physicals because it ends up being a de facto forced screening, if you will, because it's going to have some sort of screening, whether it be an EKG, a 12 lead, or whatever else the other screening labs or what have you, that is make preparing for the sports activity which is a smaller group. It's not a huge group within the different school systems and so forth and communities, but it does provide a screening tool. But then you get those who then drop out of the sports spaces who go back into the void of not being regularly seen. And of course, we all know that once you're in the young adulthood and you get new jobs and families and lives and move or whatever else it might be, unless you're military, you then fall into this gap that unless there's something catastrophic, you may not even be seen for years to come.
Exactly. I say that males wait until they're 40 and they have a heart attack.
And unfortunately, it's so true. We don't do
Yeah.
well with the preventative side, and we end up having an acute event and saying, "Oh, by the way, here are some other challenges I'm seeing with this levels up, this levels up, this levels down, and so forth." So, how can we help individuals realize and really understand not only what your organizations are doing, what your organization is doing, but how can your organization help elevate what we're doing and set up where it's great that we're looking at the youth, the male youth, but how can we instill in them a culture of understanding, hey, I need to keep this going. I need to keep this sort of screening going.
Well, there are three things really. The first is education of clinicians.
Mm,
And we do play a role in trying to educate primary care physicians about the importance of male health care adolescent male health care. The second is providing resources for them to how to
Mhm.
practice in that realm, and we provide resources in that area as well. The third is really how do we engage these guys once we get all of these ducks in a row, so to speak, how do we actually engage the young men? And that's the hardest thing to do because there are all sorts of barriers having to do with norms of masculinity and
Mm.
other issues pertaining to access that get in the way of that. So that's probably the key problem, the key barrier to getting to young men.
You bring up a really good point, and that's something we strive to do within our organization is how can we either A, help address the gap as the organization, or B, partner with groups such as yourself. And I'll tell you, we've had a lot of success in the area of trying to recruit more people into nursing, but also looking at our communities for men's health and because it is a substantial gap in that space of from the older youth into that young adult and mid-age adult. How do we keep that going? And we're trying to see more partnerships, and we're hoping that working with you even more can look at opportunities to help build these resources. So we're really thrilled to have this conversation today. What are some other resources that you have out there within your organization that can help individuals feel like they're more prepared to care for that group?
Well, the in terms of healthcare providers, we, like I said, have developed resources. For example, we've developed guides for primary care physicians to actually screen out young males that come to their office.
Hmm.
The other end of the spectrum, so to speak, is working with young men in sports and in
Hmm.
fraternities. Those are two places where they are. The thing
Hmm.
is, we've got to find where they are and go after them where they're there. And so we've developed two things. One is we've developed a program for coaches on sexual reproductive health issues, and so that they can integrate the resources that we provided into their regular dealings with the young men. Um, the other is for fraternities, and we've had a lot of success working with fraternities and with sexual and reproductive health issues as well. What is really interesting about the fraternities is that these guys, I mean, they're in college, and you'd assume that they know a lot about this stuff, but some of the questions they ask are really pretty basic, which underscores the need for this kind of training. And fraternities are a great place because, exactly like I said before, they are there and they are engaged in the process of doing these trainings. So it gives them some buy-in.
It's interesting you're talking about that too, as well as the basic knowledge that you would hope and assume would be there in a population of educated individuals who are part of a college system, and whatever the degree pathway might be. But at the same time, it underscores the gap in the youth space of where the education has been amiss, whether it be within the school systems, whether it be community systems, whether it be whatever else it might be. It's just a dismantling of equitable conversations whenever we talk about the comprehensive healthcare of humans. And so we've missed a lot of that opportunity, whether it be in middle school, high school, and so forth, of setting ourselves up for success on a larger scale. And so I appreciate the work that you're doing. I really appreciate the resources that you have available. And we'd like to share some of those resources within our organization to help get that word out even more. Because that's our goal of both of our organizations is really get the message out, get resources out, have people understand this is not a negative conversation. It really is about there's a huge gap here. How can we help augment that? And not to mention earlier intervention or earlier recognition of some of these things can help lead ourselves away from stage 2 cancer or whatever else it might be that we've missed in a preventative care type situation. So we really appreciate all the work that you're doing. In our
Thank
last
you.
few seconds that we have together, what's some big takeaways that you want our listeners to have?
Well, apart from the major one that I mentioned before, there are some issues like the mental health, for example. Um, And depression. Males exhibit depression in different ways than females. Males externalize it, females internalize it. And so, as a result of that, males are frequently diagnosed with ADHD because of their behaviors, which may be actually due to depression. There's also in terms of accidents and violence, they engage in risky behaviors, and as a result of that, they have accidents that lead to death at twice the rate of females. Homicide is 5 times the rate of females. The overall, the death rate for young males is 3 times that of young females. So that gives you kind of an outline of what some of the problems are. It's mental health, accidents and violence, and sexual and reproductive health. As I said before, these guys really do not fully understand the sexual and reproductive health and the methods that they can use to prevent STIs.
So those are some profound numbers, and I thank you for sharing. And it also just reiterates the gap in each of those stigmatized spaces and how we as a community and society have not addressed that difficulty in having some of these conversations, and we put ourselves in some of the scenarios that we're in. So I appreciate you bringing that forward, and we want to continue this messaging. And I hope to see you again maybe soon. We can talk about some updated information. So thank you again for your time, Dennis. I really appreciate your work, and please let us know how we can continue to work with you.
Thank you. Thank
All
you.
right. Thank you again. Thank you all for listening for this episode of Manifesting Health Series. See you again soon.